Hey, thanks for taking the time to join us right here, Polk Place. And joining us in studio, Natalia Clemens. She is the Patient Enrollment Coordinator for Lakeland Volunteers in Medicine. Let's tell you, man, I'm digging the new threads,
Thank
man.
you.
Yeah,
Thank you. Yes, this is a new position. I'm really excited to be a part of this incredible organization.
Yeah, you still got that new employee smell.
Yeah, right?
But talk to me a little bit about Lakeland Volunteers in Medicine. You know, we heard in the opening some of the numbers that we threw out there, but talk a little bit about Lakeland Volunteers in Medicine and, of course, the importance that it plays in this community.
You know, Lakeland Volunteers in Medicine has been in Polk County since 2001, and they provide actually free, at no cost, medical, dental, and mental health to the working uninsured of Polk County. And so, you know, being that I'm new, I've been working with Polk County residents for a long time now. And so I think that a lot of the times they will self-select out, meaning that they see this, you know, available, but they don't think, is it for me? Maybe they see the word working. Well, I'm not technically working. Maybe they're a stay-at-home mom and they think, well, I don't have a job per se that I'm getting pay stubs from. I wouldn't qualify for Lakeland Volunteers in Medicine. And so I really wanted to take today to talk about those things so that anyone listening to PGTV, which I love you guys, you guys are amazing. I really hope that they hear it and they would, you know, go to the website, LVIM.net, and just visit and see if they would qualify. Call us, see, you know, do an intake screening.
So what are some of those numbers that you're looking for when it comes to, you know, the working uninsured?
So the numbers right now, and correct me if I've misunderstood your question, what we're looking for, you know, because our name is Lakeland Volunteers in Medicine, a lot of people will think, oh, this is for Lakeland residents. No, it is for Polk County. If you are in the Haines City, Davenport, Lake Alfred area, and you are a Polk County resident, this is an option available to you. We actually just opened up a Bartow location on the in the Bartow Regional Medical Center campus. So this, you know, today I really want to, that's my hope, is that somebody in Bartow, in a location that perhaps they had in Fort Meade, they had no idea that they have the potential to qualify for free medical services. A lot of people also think, well, if it's not broke, don't fix it. I have nothing, you know, nothing's really going on. But perhaps they need some preventative care. A big thing that Lakeland Volunteers in Medicine offers is dental for those that don't have health insurance of any kind. We have dental. We have a pharmacy in our clinic. You know, there's from x-rays to ultrasounds, and if we don't have it in-house, we refer out for it, and this is free. So I also just want to even mention that the clinic, it's beautiful. Like we're not an office that's kind of, you know, scary, and our volunteers, you know, that's the biggest part of the LVIM is the V, which is we are volunteer-led with a support staff, and they are just incredible human beings who, we have such a great clinic.
One word that I heard you say, qualify. Talk to me about qualify. What does it mean to qualify?
Yes, I think that's a big one because I don't know, what are the barriers, right? Is it that you get to the website, you're not really sure what's the next step? I just would encourage people to just call. It's fine, just call. We do not mind if you have, you know, simple questions, and really the 3 questions we're asking is, number 1, are you a Polk County resident? Do you have health insurance of any kind? And then the 3rd question is the income-based question. Do you know, are you within 200% of the Florida poverty level? So already,
what is that number,
exactly.
roughly?
Already, I'm listening to that and I'm thinking, what does that even mean? So, for an example, a family of 4 that's making an income of $60,000 a year would qualify. That's broken up. That's $5,000 a month. So as long as you're a family of 4 and you're not making more than $5,000, you would qualify. And then, so that's depending on how many people are in your household. You could be a household of one and just not making more than 200, I think it's 2,430 a month. So, you know, that's always the first step is seeing if you qualify, and then we would bring you in for what we call an intake screening. And that's where you would fill out paperwork. And it really is, you know, it's really that simple. You can come in, fill out the paperwork, and that day start your lab appointment. So the process to entering really isn't that hard.
Whether it be medical, dental, or mental?
Mental health, yep.
Talk to me about the importance of, in all actuality, catching, you know, the importance of having and catching perhaps whether it's diabetes or a cavity in the early, you know, talk about the importance of a preventive versus, well, suddenly if we can't prevent it, then we're deep into it, and now we have the problem. You're
really hitting the nail on the head of preventative care, because it is harder and it is worse when you wait too long for something, and then it's difficult to find specialists or services. Preventative care is so important. I mean, I can't say enough for women, even with mammograms or just gynecology, those preventative, you know, routine visits. Those are so important. And particularly with dental too, those cleanings, making sure that you never know. You just never know. We also have dermatology. So, you know, you think about a lot of people who haven't, you know, who have perhaps something that they don't know, and they haven't done a screening. So those preventative measures are incredibly important.
Touch briefly on it. The volunteers, I've worked with a lot of volunteers within this county, and every year there's an awards program, and somehow or another somebody from LVIM is always in the finals for this. Talk about the role that the volunteers, I mean, the volunteers are what make you guys. Give yourself a chance to pitch for some, you know, volunteers to join you.
Well, this is it's actually the reason why I wanted to be on staff at Lakeland Volunteers in Medicine. I love this model because, you know, it's employees, you know, it is different when you're there 24/7, 24/7. But these volunteers, not only, so I want to also mention that it's not just medical volunteers. You know, we do have a lot of nurses, you know, we have a lot of medical assistants. So students from different schools, they can come and volunteer as well, and they're collecting their hours for whatever, you know, they need for their degree or certification. But it's also our volunteers who are just they're on the floor greeting at the door. You know, we have a lot of folks who are just coming out, who are, you know, answering the phones. It doesn't have to be just medical. It's also just our intake screeners. So a lot of the reason, like I said, I came to Lakeland Volunteers in Medicine is because of that kind of energy, that it's truly unique and beautiful to see how the community comes out and they want to help, you know, the community that they live in, those families that are in need.
Well, listen, anytime that you need to promote any program, recruit, got an event going on, anything, please come back and see me. I love what you guys do and the difference you make in this community. Wow. I really appreciate what you guys do. And you, come back and see me again soon,
I would love to, always.
Lakeland Volunteers in Medicine is a volunteer-run healthcare center that provides free, high-quality medical care to the working uninsured in Polk County. Now, you need more information and enrollment, give them a call, 863-688-5846, or look them up on the web at lvim.net.